Hi, so I wanted to take some time today to talk about the diet progression after surgery and kind of what it looks like, and hopefully to give you a visual as to how you can kind of prepare yourself, prepare your mind for that big change in what you're eating and the portions that you're eating. So I always really like to think about the first 6 weeks to 12 weeks as if you are an infant that is advancing to solid foods for the first time. So kind of thinking of the pre-op diet and the first 1 or 2 days after surgery when you're basically on clear liquids or maybe a couple full liquids as, being on, formula kind of as a baby, right? Or nursing or something. But you're basically just on a liquid. And then from there, you start to advance into purees, right? And so if you think about a baby, the first time that they eat, they don't have, a peanut butter and jelly and a whole apple, right? They start off with something like a pureed vegetable or fruit or rice cereal, something common to have, or yogurt. So very soft, basically liquid consistency. And that's exactly what you want to do the first time you have something solid again after surgery, right? So you want to do maybe a strained cream soup, maybe some diluted yogurt, or applesauce might be good, or a pureed fruit or vegetable, or a protein drink is common too. So something very liquidy, very simple, easy to tolerate. And then from there, you can advance to softer foods at about a month if you're doing the sleeve. For bypass, it can be a little bit earlier, and that's because you don't have as long of a suture line from surgery, the gastric sleeve, because they remove, 3/4 of your stomach or 2/3 of your stomach. There's a really long suture line, and you really have to let that heal. So I've had people say, well, I can tolerate, French fries, and that's true. I had someone say that, or I don't know, regular meatloaf or whatever. And just because you can tolerate it doesn't mean that it's a good thing at this point, because you really want to let that suture line heal. So there's my soapbox for that. So anyways, then from the purees, you can start to advance to kind of more soft foods. So I like to think of crock pot meals, very, very tender, moist, just need a fork to cut through meat or potato, no knives required kind of diet. And if you think about a baby, that's also what they advance to, right? Maybe some diced bananas, some cubed cheese, very, very simple, soft, tender foods, okay? You can also think about getting some baby spoons, forks. I think these are a really good, cheap investment. If you have anyone in your family that has a baby, maybe you can ask just to borrow a couple for a month or so, because these not only train your mind as far as how much you can have at a setting, but they also train your hands, right, to grab just a small amount, because that's all that can fit on your fork or your spoon. As opposed to using your normal silverware, it can be really hard to kind of keep that dime-sized bite in your mind, or getting the half teaspoon size out of what you should be having per bite. So my plug for baby spoons, forks, etc. You can also put a dime on the table. That is about the size of something that you want to eat. So if you think about like a banana, you wouldn't even want to slice a banana and have that, one whole piece. You want to cut that into at least, 2 or 3, maybe even 4 pieces, depending on how big it is. So once again, just thinking of your stomach like that of a baby. Ask yourself, would you give this to an 8-month-old? If you wouldn't, then you don't want to have it those first few weeks either. Or you want to cut it up or cook it a little bit more or make it softer, whatever it is for that food. So let me know if you have any questions. I hope this helps those of you that are maybe just a few weeks post-op, or those of you that are getting ready for surgery in the next, couple months.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.